I'm Dr. Amy Crockett. I'm one of the maternal fetal medicine physicians here, and I'm the program director for the Maternal Fetal Medicine Fellowship. I think there are a couple unique characteristics of our program. Our goal is for our graduates to come out of the program really ready to take a leadership role, whether that's on a labor and delivery unit somewhere or within their practice or within more of a traditional academic setting.
So I'm Salita Jones. I am a rising second-year maternal fetal medicine fellow here at Prisma Health. I really enjoy the complexity that I see in clinic as well as in the hospital, and I love the impact that we have on them. I think of a maternal fetal medicine specialist as a provider of hope for those patients, and they're able to carry them through to the finish line, and they're able to hopefully take home a baby with them, something that that patient may have never thought they would have had the opportunity to do.
What we really want to train people that are ready to come out and be able to make an impact with a leadership role wherever they go. Training people that are excellent at the bedside, have a lot of really good clinical experience, but also can use the tool set that we give them while they're here.
As a fellow, I think that we have more of a leadership role. As a clinical instructor, I take call as a generalist, and so I am on labor and delivery with the residents, and I am the faculty. And so it's really me managing these patients with the residents.
We also expect our fellows to be highly engaged teachers while they're here, so they practice in a faculty capacity, supervising the residents on labor and delivery, for sure at night on calls, but also when they're running the labor and delivery unit. In general, when you look at our program, we're balanced more towards the maternal medicine side of things than we are towards the fetal intervention side of things. We, of course, have a really strong experience for the fellows doing prenatal diagnosis with ultrasound. That just is kind of the bread and butter of our specialty. But really our strength is in managing women with complex pregnancies. Our fellows also spend a little bit more time on labor and delivery compared to other programs. The national requirement is for them to spend 2 months in a supervisory position on labor and delivery. We have our fellows spend 3 months up there. The labor and delivery unit is an enormous, very diverse team that includes a lot of different nurses, trainees, consulting practices, general OBGYNs to midwives, to be able to flourish in that kind of environment and really be able to lead the team towards getting the best care and the best outcomes for patients.
One of the things that I found interesting about this program was the research. I was pretty intrigued with my fellowship director and her work in centering pregnancy, as well as particularly her work with racial disparities.
We're at a tertiary care center, which is the level 4 NICU in our region. We draw the high-risk and complicated patients from a wider population of about 10,000 deliveries. So it's really nice. It's a way to get the cream of the crop, or really the focused population of the most interesting cases without having to have so much of the routine OB volume. So really the first kind of 4 months, I just expect the fellows to sort of get their feet underneath them and start to identify a mentor. And then by the second half of the year, the focus goes more into being able to start developing the idea for the research projects. That work falls to the fellows. And so because it can be so time consuming, we have blocks and blocks of research months together during the second year so that they have the ability and the freedom to really troubleshoot those projects. The third year is really trying to transition towards independent practice. It means developing those skills to run a full ultrasound unit, because that's just what you'll be expected to do in practice every day. Drafting the ultrasound reports, counseling the patients, and managing a really busy profile are some of the goals that we have, and the focus for the last 6 months of the fellowship is getting ready for practice.
Here it does feel like a wealth of support, and it feels like people actually care, and they want to see you succeed, and they want to teach you, and they want you to go off and be the person in that career that you want to be.
And one of our other really unique opportunities is that we put all of our fellows through a 2-year certificate program at Clemson University. It's a certificate in clinical and translational research. It's a really nice way to have a structured base in some of the science behind the quality improvement work that is so important for us here.
I think the most inspiring about being here, or this department in particular, is all of the female leadership. And so that's inspiring to me because I strive to be like that. I strive to have the leadership capabilities to be able to manage multiple tasks at once and just be a strong person for my patients.
I do think, though, the institutional culture here is unique and really important, and that's what makes it a nice place to work, either as a fellow that's kind of in this hybrid position between the residents and the faculty, or as faculty. There's lots of people around that have a lot of involvement and engagement and commitment to teaching and to our fellows.
Overall, being a fellow is a lot different from being a resident. It's a lot more relaxed, but very intense at the same time. It's hard, but I think that it's very rewarding, and I'm just very happy to be here.